It's my honor and pleasure to welcome our first guest today, Dr. Tolullah Oni. Dr. Oni is a public health physician scientist and an urban epidemiologist at the University of Cambridge. She completed her medical training at University College in London with postgraduate medical training in the UK and Australia. She holds a master's in public health and a research doctorate in clinical epidemiology. She has published over 40 contributions in high impact journals and has given presentations at the United Nations, at the World Economic Forum, and many other occasions. Dr. Tolullah Oni, it's such an honor to have you. Thank you for being here. Dr. Oni will be talking to Emer Duff, Dr. Emer Duff, I should say, as Emer is a medical doctor herself. She is currently working at the St. James Hospital in Dublin. She's actually calling in from the hospital itself. She graduated in medicine from Trinity College in 2017. And in 2019, she completed an MBA. And she's also an active member of Irish Doctors for the Environment. And of course, she is a 2019 Young Global Changer. Emer and Tolullah, thank you so much, and I'm really looking forward to your conversation.
Thank you for the introductions, LA, and thank you for having us here. We're delighted to be here, and thanks for all your work in making this possible. Welcome, Tolullah. We're so privileged and honored to have you here, and thank you so much for this conversation.
Oh, thank you. It's a pleasure. Thank you for the invitation. I look forward to the next hour or so.
Lovely. So we've heard you're a rock star public health physician, researcher, and someone who I think whose expertise are needed more than ever at the moment. Could you fill us in a little bit about what exactly an urban epidemiologist does, and also how you view the pandemic with that lens?
Thanks, Emer. Firstly, I have to say it might be the first time I've heard the words rock star and public health in the same sentence, which is quite nice. Given that public health is often the Cinderella discipline of medicine and health in general, but I suppose these are the times that we live in. So I do indeed call myself an urban epidemiologist, and I suspect if you look that up, you will struggle to find what it is, and that's partly because I invented the term, which is one of the first things I learned along the way. If it doesn't exist, make it up, because it captures what I do. So when we talk about epidemiology, the root of epidemiology really is to understand the burden of disease and the drivers of disease in a given setting. The challenge is that when you're not necessarily limited to a particular disease, it becomes difficult to describe yourself. So you could be a diabetes epidemiologist or a cardiovascular epidemiologist, but actually when you're looking at health and you want to understand how health is distributed, how health is created or undermined, how different aspects of the urban environment influence health, what do you call that? Well, I'd say an urban epidemiologist. So that's kind of how it came about, because I'm a health researcher, not a disease researcher. So it's really making that stance for it, that claim for it. So your follow-on question was how I view the pandemic is, goodness, I'm going to have to ask you what you mean by that, but I'll share some initial reflections. So I was the first person on the personal level. So the first kind of real disruption happened when I met in March last year for me. Or actually it was in February. I was, before the disruption, I was having a project initiation meeting for a new project we're starting with partners in Lagos, Nigeria, and Yaoundé in Cameroon. And we were having the meeting in Cambridge. And I was having the meeting at my college at Cambridge. And I remember speaking to somebody at the dinner in public health. I said, there is this virus from China, like we've got a couple of people at the moment, but it's all kind of, and I thought, goodness, what is going on? And the person didn't quite know So there was this initial. So the first thing that struck me about the pandemic was communication, right? And how little there was of it in terms of transparency and really engaging with the public in being honest about what was going on. And then in a month or so later, I was in South Africa for some work. And I remember going into the border then, and the only question being asked was, have you been to the Far East recently? And that was in March. And I said, well, no. I mean, I've been lots of different places, but you didn't ask me. So that was a very limited understanding of how far things had gotten. This was early March. So the second thing that struck me about the pandemic was really how, apart from the communication, how slow we were to, in general, to adapt to a changing reality. So even though by March, really, we should have known that, and we did know that, that the SARS-CoV-2 virus had spread globally, crossing a border, I was still being asked if I'd been to China or the Far East. And coming back here to the UK, I wasn't even asked anything. And that was mid-March. Right. So that was the kind of communication in terms of transparency and adaptability were two things that struck me as being fairly limited over the course of the pandemic, at the start of the pandemic. Obviously, things have changed in fits and bursts along the way. And I'd say maybe the third thing that has really struck me is that at the start of the pandemic, it was really, the word pandemic, it's a once in a generation, right? So most people living hadn't been through something of this global scale where every single country was dealing with this same issue. So the narrative then was, we're all in the same boat, what are we going to do? And it very quickly became obvious that, we were all in the same storm, but not in the same boat. And the issues of inequality really started sticking out, becoming very apparent. And so it was very striking to me how surprising the inequality was to people who hadn't been dealing with in the equality space for a while, right? So everyone's like, wow. For example, I'm sitting in London at the moment, people are like, wow, did you know that, there's so many children who don't have, yeah, that's been happening before the pandemic. Did you know the levels of childhood food hunger? Did you know the levels of inequality with respect to access to healthcare, even when healthcare is free? If you ask anyone working in healthcare, they'll say, yeah, we know that because we know that certain populations have poorer access, and we see that bearing in terms of the outcomes. So there was this dissonance between first thinking we're all in it together, and then realizing that there was this inequality, but then that actually this inequality was there all along. And so it wasn't something that should have been surprising, but actually something that we should have proactively acted on. So those are, when you say, how do I view this pandemic, those would be the three things that I would think about. So communication, adaptability, and inequality.
Thanks so much, Tolullah. That's definitely really interesting, and I think we've all seen that the pandemic has shone spotlight on existing vulnerabilities and really brought those into sharp relief. And I suppose on that note, as you said, that we all are in this storm and in different boats. I was going to ask a bit more about that in terms of which societies do you think were more prepared for this, and do we know why, and do we feel that societies where there was, less inequality, were these societies more prepared?
Mm-hmm. Yeah, it's a good question. I think the first thing I would premise my response on is just maybe noting that society in and of itself is it's a heterogeneous being, right? So when we talk about society, we already aggregate numbers to say a national level, and we're comparing countries. So that's the first thing. So we can compare countries and talk about that, but I think it is really important to also go subnationally and to look at the details there. So if we talk about societies at the kind of country level, You know, I'm sure you will all be familiar with this by now, but if not before, but you know, there were several preparedness, health security preparedness indices that existed. You know, these rankings have who are the top 10 countries that are prepared for any kind of infectious disease or any health security issues. And what transpired from that ranking that was actually done, the last one done fairly recently, was that you would expect there to be, you know, the highest ranking countries would be the ones that are best prepared and best responded to the pandemic. So you'd expect that to be an association. And there was actually an association. It's just that it was an almost inverse association, where the countries at the top of that ranking were some of the worst performing in terms of the pandemic. So, which was quite striking, and particularly North America and countries in Europe, both in terms of mortality, morbidity, protection of the most vulnerable, etc. So if you ask what some of the things that we know now were kind of protective and countries that did much better, you know, if you compare a country like Vietnam that has a similar population size to the UK, but until the end of last year, you know, where the UK had almost 100,000 deaths, we had Vietnam had something like 60. You know, in the same country, in a country of the same size. So a couple of things stand out. One is experience. Countries that have had experience of dealing with an epidemic of some sort. So in the Far Asian and South Asian countries, it was around, you know, the previous SARS outbreaks and epidemics that they had to deal with before, that we know about here, but didn't quite, you know. But so they were quick to act and acted very decisively early on in the game. The other characteristic that comes out is political leadership. So leadership that's able to, again, act decisively, but also act in a flexible, so able to change course quickly and react and respond to a changing reality. And I would say the third thing that is notable is trust. Societies that are more have a more cohesion, sort of in terms of social cohesion, more trust in your neighbor, more trust in your government and your leadership. Those factors all meant that a combination of leadership and trust meant communication was there, meant engagement and participation was there, meant that people were more readily able to comply. And so maybe the fourth thing I would say is also putting in place measures, countries that put in place measures to support adherence to the public health control measures. And in order to do that, you have to firstly have a good sense of what the potential implications of any public health control measures are. And you have to have a sense of the fact that those impacts don't necessarily influence everyone equally. So you have to then put in place measures like, how can we ensure that when we say stay at home, that you're not, that some people, knowing that some people can do that, but some people can't do that without going hungry. So if you actually need people to stay at home, what measures can you put in place to support that? And who does that look like? So you have to have an understanding of that inequality to start off with. So those are some of the factors in terms of preparedness that we saw that made a difference in countries. And in terms of response, the key things were, again, acting early, but also local action. So decentralized community level action, tapping into existing frameworks, which obviously helps to build trust, etc. So that's kind of at the national level. It's much more complex picture at a subnational level, because then you have to look at the levels of inequality within a country and whether or not the responses are tailored to protecting the most exposed and the most vulnerable.
Thank you so much. And I think, they're really, holistic points, and really underlines the importance of leadership. And I suppose, not just technical preparedness for a pandemic, but the right leader and the right, the right responses from those leaders. Mm-hmm. And I suppose the importance of empathy and the importance of leaders understanding inequality. And also, I suppose that, as you say, experience of a pandemic also is key for, almost like SARS almost inoculated certain countries against COVID, from the point of view of their responses, in that their societies, were aware of pandemics and aware of responses to them, and they had contact tracing abilities set up prior to this pandemic coming about and things like that. So, they're fascinating points.
I was just thinking that the one thing I wanted to add, from the other end, is if you're going to ask me one of the types of characteristics that were associated with the suboptimal response, if you like, in addition to the mirror responses to what I've just said so far, one of the key critical characteristics I've noticed is around diversity of perspective. So, because I just got reminded by something you just said, Ima, around knowing that if you're the leader of a country and all your advisors are people like you, who went to the same type of school, who have the same type of, then you make decisions that are obvious, right? Because you think, well, what could possibly happen? No, I can't think of any potential harm here, because you don't actually have a diversity of experience. So that cuts across even the scientific advisory structures and the different forms of disciplines that informed, that comprise the science advisory structures within countries. In the initial phases, the UK had a lot of critique because the initial formal structure was very limited to particular disciplines, and there was very little there was a lot of underrepresentation of, say, public health, behavioral science, all of these things that we know are really critical to bringing people with you. So I just wanted to flag that kind of diversity of perspective as being really critical at every stage level of society.
I couldn't agree more. And I suppose another question is, at the moment, this is probably $1 million question and difficult to answer, but I suppose everyone at the moment is, using the term post-COVID. And do you think that we will ever be post-COVID, or do you think that we'll be living with COVID, or it may mutate, or is this impossible to answer right now?
It's interesting, because I actually see the term in a slightly different way. So I see post-COVID as the opposite of pre-COVID. So we were pre-COVID until January, right? Maybe we were peri-COVID January last year, 2020. Maybe we're peri-COVID around January to April, as it was kind of spreading. But we've been post-COVID since April. And by that, I mean, we've been in a reality where we've been living through a pandemic and having to deal with the consequences thereof. And I say that because I don't want us to get to a pre-COVID state, because actually pre-COVID was not great for a lot of people. So post-COVID for me means a world where we've either dealing with or have recently dealt with a pandemic that has exposed critical flaws in our societal structures and has forced us to stand in front of the mirror to consider what kinds of future we want, and whatever decisions we make from then on, we can't say there's no pretense of ignorance. You can't not know about the inequality in the country. You can't not know about the impacts of a skewed economy. You can't not know about what the potential for something like the climate change disruptions will have. You can't plead ignorance. So that for me is a post-COVID society. So now what are we going to do with that? So I embrace post-COVID as a context of, with pre-COVID being see no evil, hear no evil, speak no evil kind of stage, and post-COVID being a stage where we actually need to be. I had a briefing last week, and we were talking about a public briefing. We're talking about in the UK at the moment, whether or not people can go on holiday, and where to go, etc. And I had a moment, because it just seemed so terribly premature, and it just seemed so insular, and I just suddenly had this, I suddenly thought, gosh, is this how we're going to be dealing with the climate change related disruptions, that we'll just get out of it quickly and then we'll just try and ignore what else is going on in the world? Because it's not going to be possible, right? So it's not about individual, yes, we have individual will, we have individual choices to make. But I think if there's one thing a post-COVID world should be, is understanding the impact of the individual on the collective. And the impact of the collective, what the impact of the collective knowledge and broader understanding of the challenges that we face and should be on individual. So that for me is a post-COVID world that is much more connected, and much more connected to that future reality, if you like. So in so doing, I've completely sidelined your question about whether, because to be honest, I don't know. If you mean post-COVID in terms of the pandemic ends and then we stop living, I think it's too early to tell. We don't know where, we're still understanding how this virus mutates, what happens in different population groups, at different age groups, and the rest of that. But for me, the post-COVID state is the ripple effect of how this virus has rippled through and torn apart to the veil of we're doing okay because we weren't doing okay.
Wow. I love that response. And what I really love about it is that not only have you invented the term urban epidemiologist, but you've also reinvented and reimagined the term post-COVID into being something that's not reverting to our old society and going back to the old normal, but as it were, transcending what's possible and using this crisis to really examine deeper questions in our society and actively imagine how we can create a society where we're less vulnerable to these things happening, and where the fault lines in our societies that were exposed by COVID are strengthened, and people and public health is actually brought into the discourse in all domains and all policies. So I love that response. Wonderful.
And because that it's a joined up thinking that we need, right, with that, because and you already see it fraying at the edges. So COVID, it's funny because in my training, my medical training, I started off in infectious diseases. So because I was practicing medicine in infectious diseases, when I moved to research, I started off in infectious diseases research, and then I moved to the overlap with infectious and non-communicable, and then I slowly moved out of disease into health, right? And I remember when I was transitioning in that stage, and this conversation is still happening. I had an interview a couple of weeks ago, and somebody asked me, do you think that we were not prepared globally for this pandemic because we've been focusing on non-communicable diseases? And I said, I'm sorry, but that question is nonsense. It doesn't make any sense, because if there anything we've seen with COVID, how nonsensical those divides are. I mean, I understand it from the perspective of clinical training, but actually from the context of epidemiology, from the context of public health, COVID is a perfect example of that. So, countries that have over 50% of people overweight or obese had a 10-fold higher mortality from COVID than countries that had a lower rate of obesity. Air pollution exposure increased your risk of severity to COVID. We've seen that physical activity, as recent study, physical activity is likely to boost your antibody response post-vaccination. So suddenly it's like, so it's COVID and just in infectious diseases then. We know that diabetes increased your risk of severe diabetes and heart disease and lung disease, increased your risk of severe COVID. So can you just say, oh no, which one do we choose, infectious or non-communicable? It doesn't make any sense. We have to actually improve population health resilience. And in order to do that, we have to look at the drivers of ill health, where they may occur, whatever they cause. You know, air pollution is, you know, air pollution is not an exposure for infectious diseases or non-communicable. It cuts across. So we have to start.
So true.
It's
been such a, you know, it's really shown how, you know, these academic distinctions are tidy and they help us in some levels, but they're ultimately unhelpful when, you know, when we really do need to see things in their full light. So that's I totally agree with that. And at the moment, we actually have one of our young global changers, Dr. Fontip, has some questions. So I'm delighted to invite Dr. Fontip to unmute and turn on the camera, and feel free to ask your questions to Tolullah as well.
Great.
Hi, Tolullah.
Can
you hear me?
Yes.
Hi. So yeah, my name is Dr. Fontip from Thailand. I used to meet you 2 years ago at Berlin. But I have some questions to ask you. The first one is about we all talk about physical health during COVID, but I think mental health is also like really important issue, but we not many people talk about it. So I wonder that in your opinion, how could we make the mental health also the priority that we should focus on, and not only among population, and I think the mental health during the healthcare worker is also important issue, but no one talk about it. So I wonder that how can we improve this?
Yeah. Thank you, Fontip. That's such an important question, because mental health is one of those things, again, it cuts across the spectrum of health, from kind of primordial and primary prevention all the way to treatment and care, right? And everything in between. So how do we protect mental health, and how do we ensure people have access to mental health care across different life stages, firstly. Secondly, it's one of those cross-cutting health issues that is often overlooked when we think about, well, what is the, you know, if we have put in a public health intervention to say, okay, again, stay at home, it's like, what is the mental health potential? You know, what is potentially the mental health impact of this? And it's not an either or, right? So if we have to do anyway, how do we mitigate against the mental health? Because that's the challenge. Sometimes people stay away from that complexity. They say, well, it doesn't matter what the mental health impact is, because we have to do it anyway. It's like, well, no, actually, there are ways that you can protect health even through the acute phase of the pandemic. And again, for that, you have to know who needs protecting the most, who is most vulnerable, whether that is because of age, whether that's because of occupation, whether that's because of geography in terms of isolation. And I want to give you a little anecdote to highlight the fact that sometimes the things that we think we know are untrue. So I was actually reading, and the other people may have seen this, I read a newspaper article that was written by this relatively young woman who you know, was living alone during the lockdowns, etc., and you know, struggling a little bit with mental health, and then but then thought, okay, you know, actually maybe if I help, there are other people that need help, then I will reach out and help others. And she thought, oh, there's lots of old people in this country, so she found this loneliness hotline and in the community, and she got paired with this 90-something-year-old man who lived alone, and she thought, okay, this is going to give me purpose. I'm going to help this lonely old person. And they started talking. Obviously they couldn't meet, but they were talking every day. And he was from a different country, and at some point he didn't answer. She got really worried, and it transpired that eventually she was comfortable enough to say that, actually, you know, I've been feeling really lonely and my mental health has been suffering. And then he felt comfortable enough to say, oh, actually, I was completely fine. I wasn't lonely at all. And she thought, well, why did you sign up for the mental health loneliness helpline? And she says, well, I was curious. I thought, well, let's see. So actually, the person who was helping and the person who was being helped was the opposite of what you would have expected. And the point is that I want to raise is that often mental health is hidden. There are people who we think need support, and but then there are people who we think don't. And it's really important that our preconceived notions of if there's a young person and an old person, then it's the young person helping the old person, is problematic, right? Because we take that deficit approach, like all old people need help, whereas actually, there are lots of young people that are really suffering with mental health, especially those in school and still in training. I mean, the disruptions. And so it's really critical to address mental health. You have to tackle the biases, I think, and the preconceived notions of who needs help or who could potentially be of help.
Thank you, Tolullah. And we also have another question from Sudesh, who I'll invite now to unmute and turn on his video also to ask you a question. Thanks, Sudesh.
Tolullah, that was quite an interesting analysis in terms of pre-COVID and post-COVID. And honestly, in my opinion, I think that, when we are talking in terms of post-COVID, I think we are living in a utopian world because we are counting our chickens before it's hatched. It's something which is miles to go. And I believe that, humanity is again, reacting too fast. So in that sense, lately, I have seen a lot that, people are questioning more developed countries or more larger countries to be responsible towards least developed countries or smaller countries. But then I also see that these smaller countries are doing much better than these larger countries. So do you think that in this context, the larger countries or the more developed countries has something to learn? Does it have something to learn or take away from the smaller countries per se?
Goodness, Sudesh, how long do you have? Because this issue is so critical, and there was a reason why, Emma, when you talked about when you go subnational, you realize quite a lot of the developing rhetoric is branding, because it is really, I mean, I find it, I just moved back to the UK 3 years ago. I'd been living in South Africa for over a decade before that. And so things that I should have known when I was living here last, but I didn't really see, but I see now, are so striking. And because I've moved to a developed country, I just find it so disgraceful. It's just in a land of plenty for us all to just be walking around normal and just thinking this is okay, we live in a great country, when in the borough next to me, 1 in 15 people are homeless, where you have like incredible rates of where children are. Last year was the first time ever UNICEF fed children in the UK because of the childhood levels of hunger. I mean, it's disgraceful. So when I talk about developing, I feel like we just have to unravel that to start off with, because there are lots of developing countries in the UK, if you see what I mean, or even in England. England has a lot of developing countries in it. It's just it's overall GDP, etc. So that's the one thing to say. And if you saw it that way, it would be easier to perhaps set aside that hubris of we're Great Britain, so we have nothing to learn from others, and we're the teachers, or we're the US, or we're the because that is really problematic. And we actually had one of the problems very early on in the pandemic, where we here in the UK didn't follow the WHO advice on what to do, and it was perceived that, oh no, WHO advice is for poor countries, we kind of know better, so we'll do our own thing. And so unsurprisingly, that didn't work out well for us. Some of the things that by comparison, and one of the key things that I found that I could learn very easily from the South African experience. So in the first wave of the pandemic, the response was really quite, early, timely, comprehensive, and it leveraged the existing community structures, right? So when we talk about contact tracing, whilst we were battling with whether or not the app was working, whether or not people were, you had countries like South Africa that were leveraging the community health workers to actually do the kind of shoe leather epidemiology that we know works, where you go door to door and you connect with people that are in your community that you know about, to say, do you have symptoms? Who have you been in touch with? To do forward tracing to find out where you've been, but also backward tracing to find out who else you might, where you might have caught, being exposed. Those kind of, we call this shoe leather epidemiology because it's back to basics, right? But there is sometimes an attitude that, we're too advanced for that. So, but actually, what we've seen in the pandemic is that kind of basic community mobilization was so much more effective, because even when we got an app here up and running, we still had huge pockets of the country that were not being connected to, because who is on the end of the phone? I don't know who you are. Why would I open the door? Why would I tell you if I have symptoms and not? So that trust wasn't there. And so if we had learned here, for example, that, okay, this is happening in these countries, let's try that here. It's the same, by the way, in Asia, the Asian countries that did well, Taiwan and etc. It was really community health or community worker mobilization to identify cases early and to work with people to support isolation that worked out. So I absolutely agree with that observation, Sudesh, that there is a lot that we can all learn from each other. But in order to do that, we have to set aside the hubris of exceptionalism, of where you can learn lessons from.
Thank you so much. I think that you keep underlining, fundamental lessons in public health and global health that are being, shown through this pandemic. We have one final question from Zira before we wrap up this session. So Zira, please feel free to go ahead and ask your question.
So first of all, I'm so thankful for this beautiful conversation from the beginning. It was really beautiful to listen your perspectives on different segments. I wonder something related to the pandemic and its effect on aggressiveness, this hidden aggressiveness. So pandemic definitely affected our lives in different manners. And some psychologists even mentioned there's an hidden stress in society waiting for explosion. And at the same time, in different places on the world, we are just observing different humanitarian crises, social actions. And I wonder your point of view about this relation. Is there any relation with pandemic restrictions and this kind of aggressiveness exploiting in the societies?
Wow, Zara, what a question. The short answer is I don't know directly the answer to your question. If I was going to think about it a little bit more, what I would say is that I think that, again, before the pandemic, the growing inequality pretty much that we've seen universally has had these tensions, there's lots of these tensions simmering just below the surface in lots of different ways. But before the pandemic, they're in ways that were largely ignorable, either because we were, in spaces where, I say ignorable as in people, we could just pretend everything is fine, either because there are population groups within our societies that we ignore anyway, right? In terms of their concerns and their, we are in the middle of 2020 with the Black Lives Matter movement and everything going on that started off in the US. In the UK, we're still having a discussion about whether or not institutional racism is real. I mean, that's kind of, so if you have that kind of significant proportions of your population experiencing microaggressions on a day-to-day basis, it's certainly not a good ingredient for any recipe if you have a societal disruption, right? Same goes for, so that's an example in terms of ethnicity and race, but same goes for populations in terms of age. So I'm Nigerian, I work across the African continent, where we have the majority of people are young, but a lot of young people are excluded from society, either from decision making, either from education, either from employment. And so you've had also that simmering exclusion that comes very, you know, that their exclusion and inequality are cousins, right? So you have a society that is highly unequal. You have groups of people who actually are well placed to be contributing to society, but are being actively excluded. You know, so in the worst, your best case scenario at that point is actually to keep them excluded and keep them uneducated, because if they get connected and they get mobilized, and you wait for an issue, something disrupts society, it's you can see why, you know, that would cause an even broader, bigger disruption. So it's interesting when we talk about health emergencies. I just want to use this point also to make the distinction between emergencies and catastrophes, right? So the emergencies that we can prevent, and we don't often talk about the preventing the preventable. It's just we don't see them as preventable because of the long time mark. We did something 20 years ago and then an emergency happened, so we say it's not preventable. A lot of things are preventable, but then they're the unavoidable emergencies. And the question is what we do to prevent the unavoidable emergencies from becoming catastrophes. And a lot of that relates to dealing with that inequality and exclusion, because if you have a critical mass of population that's unhappy, that is excluded, that is angry, rightfully angry, then you have a situation where that is compounded by emergency that results in loss of livelihoods, results in loss of income, results in hunger. You can see how those two going together could cause a catastrophe. Whereas if you're thinking about population resilience, you're thinking, how do we make people less vulnerable and less exposed to exposure? A critical part of that is participation and inclusion. You bring people in, people are part of decision making, people are part of it's not an either or, that it's not like it's then a perfect world, but you're part of the problem solving, you're part of looking at what the issues are, you feel heard, right? When you have an emergency response, you're more confident that your perspective will contribute to that response, and your lived experience will be reflected in that response, and you're then more likely to accept and participate in a way that is better for the collective good. So I don't know the answer to your question about whether the pandemic directly is what we see in terms of humanitarian crisis, but what I do know is undoubtedly the exclusion and inequalities that preceded the pandemic play a role in making people even more desperate, even more angry, and even more excluded. But the post-COVID response is an opportunity to confront that, acknowledge that, and address that.
Thank you so much, Tolullah. Your talk has really amplified that health is a political choice, and that now is the time for transformative change, to reimagine what is to come, to take this time where there is disruption as the opportunity for change and the opportunity to realign those systems that have lost their way, which I think is really the spirit of the Global Solutions Initiative. So I'd like to thank you for your time, for giving us this incredible insight, these amazing perspectives, and your expertise, as well as your enthusiasm and charisma. And I'd like to thank everyone who's come here today, all of the young global changers, for coming along to this conversation, and to Ole and all the team for organising it. And with that, unfortunately, we have to close. I think we could have chatted for so much longer. There's so many more questions, but I think I'd recommend anyone who'd like to read more of your work to take a look at the articles you've written and the blogs you've written. They're all, and the videos you have, they're fascinating. And I wish you all the best in your change making and transformation, and hope that we're all going to come away from here inspired to do the same.
I really look forward to, I think, you know, seeing what change you all affect. And I'll maybe leave you with two things. One is something that I think hasn't got sufficient airtime, and I don't know why. A year ago already, May last year, the World Health Organization wrote a manifesto for a healthy recovery, and they actually talked about writing a prescription for a healthy and green recovery. If you haven't seen it, I encourage you to have a look at it, because it's six things we need to do, and it's just the most exhaustive. And every time I look at it, I think, yeah, why aren't we just saying, here's a prescription. Okay, we're now in the pandemic, here's a prescription, here's what we need to do, because it's so exhaustive and it covers a lot of the issues that we talked about here. And then the second thing is a cheeky plug, that if you are anyone from, in and of, or from the African continent, I would love to get in touch, because we have an Urban Better movement that's focused on the African continent, and we profile and feature young people doing incredible things. And so I'd love to hear from you and amplify and connect you to others who are doing really incredible things around the continent as well on that. So have a look at urbanbetter.science, or just find me on Twitter and I can direct you. So, but thank you all very much, and I appreciate the invitation. I look forward to seeing what happens and seeing how you all embrace the post-COVID challenge.
Thank you so much.
Take care.
Bye, everyone.